Yeah, but now you've got another test, Ahmed, and you've got one on skin health. So this is, I guess, for me, what made it really fascinating was the nutrigenomics is a test that just looks at diet, but then you've got one that looks at the genetics as it relates to skin health. So explain that and what led you to that, because for people who are following us in aesthetics, I think that's really fascinating, and certainly the whole personalized skincare market. Not that this is what that is, but there is certainly a strong movement towards genetic personalized skincare. So that really caught my interest, and that's kind of this next test that we did, and you guys did that sample that test based on a sample I initially gave. But what led you to this, Ahmed?
Sure. Well, I mean, even though we are a genetic testing company, I actually like to consider us as being more of a nutrition company, a personalized nutrition company. So we use genetics really just to provide more precise recommendations on diet and healthy eating. And so, having said that, again, even though my lab has not done research yet directly on skin health, some of my other colleagues have. And so, as you know, we look through the scientific literature and look at the studies. It became evident that hey, this is yet another excellent example of how genetics can be used to provide um, personalized nutrition recommendations for skin health, as opposed to athletic performance or heart disease or premenstrual symptoms. So um, it was very interesting for me to delve into that scientific literature and to see the research that's been conducted on things like facial pigmented spots, skin elasticity, and other measures of skin health. In fact, there was just a couple of months ago a clinical trial that was published showing the effects of almond consumption on wrinkles and measurable. And so, in terms of it was an intervention that was done for a few months, I believe about 3 months. And the group that consumed almonds on a daily basis had a measurable decrease in the size and number of wrinkles on their face. And we know, of course, that almonds are an excellent source of vitamin E. And so one of the markers in our panel looks at the genetics of vitamin E metabolism and blood levels and provides recommendations there. There are some genes that influence collagen breakdown in the body and the person's elasticity in their skin. So obviously genetics plays a role and environment plays a role, such as nutrition. And it's interesting to see how some people who have perhaps a genetic predisposition to having earlier signs of skin aging, that there's actually something that they can do about it. Targeted advice that can help them kind of mitigate those genetic risks. So that's an area of research that I think is going to continue to grow. But again, there's already sufficient evidence for us to have created this report on skin health.
So I thought it was fascinating. I mean, some of the outcomes were really interesting. As you mentioned, there was one about pigmentation, and there was a test in there that outlined a person's risk for having facial pigmentation or increased pigmentation, and I presume that's kind of growth of pigmentation spots. And then there's also like you've got things in there that look at vitamin A, vitamin C, antioxidants, sugar metabolism, and how that leads to kind of skin elasticity. So, do you think, having said all that, because when you read this, it tells you, it gives you a kind of what your allele is for a particular gene, and then what your risk is for having some kind of that deficiency within your skin. I guess the next question is, do you think that the next link in the chain is you do a test like this and it tells you that, for instance, your skin vitamin C levels are a little bit low, and you need to increase your vitamin C intake in order to improve that within your general skin health. Is it so specific that you can kind of make those inferences?
So something that we do in clinic when we're implementing this testing is that we quite often recommend that people have their blood measures as well, so that we can look at, I mean, the blood measurement of vitamin C isn't amazing. I don't know if there's a way to measure vitamin C in your skin. If that is, I think it's really good to have that instantaneous. What are your levels right now? And that genetic, what are you at risk for? What do you need to get more of genetically? So that's what we usually recommend in clinic, is that if we're going to have this done, also get your blood work done so we can see where you are sitting right now and pair that together with like your genetics. Right. So I think that, like, to me, I'm like, yes, those need to go together.
Yeah, I mean, I absolutely agree with Lisa. I mean, ideally, we would like to be able to have blood levels for everyone. In fact, and yet another area that we collaborate on, not to change subjects, but just because we'll come back to skin health, but we collaborate with some urologists at Mount Sinai Hospital looking at male infertility, because we know that diet affects sperm health, and that approximately 30% of cases of infertility are due to the male factor. So again, I love doing research on areas that are virtually underexplored. And what they found was, because they started measuring some of these blood biomarkers of certain nutrients like ascorbic acid, which is vitamin C, the circulating form, as well as 25-hydroxyvitamin D, that they are now running this routinely on every single patient that goes into the clinic, because they found that the levels, that there's a high proportion of individuals that have suboptimal blood levels. So what our genetic test does is, it doesn't tell you, as Lisa mentioned, your current status. It tells you your genetic predisposition if you're not getting adequate amounts in your diet. But ideally, you would want to have both bits of information: your current status, which is influenced partly by your recent diet, as well as your genetics, which tells you, all right, is this something you need to be more mindful of and make sure that you're getting adequate amounts every day? Or are you lucky? There's so many aspects of our diet, right? And so many recommendations, so many nutrients. It's tough to keep up to date with all of these different recommendations. So, as Lisa described how she, reviews a report with the client, you kind of focus on a few things. And if you can focus on improving, 5 or 6 aspects of your diet, that's great. Kind of the low-hanging fruit. What is the immediate things that you can do now? And then obviously, we've heard from a lot of consumers who've had our tests through their practitioners that, they've gone back and looked at their report several months later and then saw something else that they're like, oh, I didn't realize that, I also have an elevated risk for, choline. And so, they start focusing on that aspect of their diet as they improve one thing over another. But going back to skin health, skin health, starts from the inside out. And so things like antioxidants, whether they're water-soluble antioxidants like vitamin C or vitamin E that are lipid-soluble, you have to ensure that you're getting adequate amounts in your circulation, because that's what bathes your skin cells and ultimately affects things like premature signs of aging.
So I'm gonna ask again though. Do you think a test like this can ultimately be used to personalize a skincare regimen? And that.
Sorry, I forgot your original question.
That's all right. Well, that's there are companies now that are doing that. So they're doing kind of and seems to be your specialty, the genetics of your nutrition. And so how valid is that? Do you think it's so specific that you can actually come down to what kind of topical creams that you need to put on for an individual based on their genetic testing?
Yeah, I mean, the science isn't there to clearly demonstrate that, but I think we have enough circumstantial evidence from some of the science that has been conducted to say, you know what, it might not be a bad idea. You have these genetic variants that clearly increase your risk of, collagen breakdown in your skin and loss of elasticity. So whether this particular product is going to help it or not, at least you're bringing their skin health, to the forefront of their mind in terms of recognizing, hey, you know what, maybe I should be more mindful of, staying out of the sun or putting on sufficient sunscreen and consuming more fresh fruits and vegetables that increase my antioxidant defenses, the defenses in my body that help to fight free radicals that cause damage to skin, which we know. So again, while the science might not be super robust for some of these products, and I haven't really seen how they're marketed, I think I think the test is certainly worthwhile, and if it makes you more, diligent in using sunscreen and other measures like that, then I think that can only be positive.